How can I gauge my partner's sexual compatibility with mine before marriage? How can I gauge my partner's sexual compatibility with mine before marriage? So I welcome you to the Iaam show.
Thank you, ma'am.
Thank you,
Please,
ma'am.
can you introduce yourself to the audience?
My name is ASK DR SEUN. Surprisingly, for those that don't know, I train as a medical laboratory scientist.
So I'm smiling because I know many people know the photography side of him. They don't know that he's actually a medical laboratory scientist. So
Yeah.
the cat is out of the bag now. And you, ma'am?
Okay, I am Ademayowa Adesonya. I'm a trained medical doctor, currently working in the obs and gynae field.
Wow. So we have medical powerhouse in the environment today. You want to run tests, the husband is the point of call. And you want the interpretation of your test, the wife is the point of call. But we are going to be talking along the line of a specialization and also their experience as a couple. They are into medical practice. She's in the obs and gynae department of it. Yet this couple had to overcome having to wait over a period of years before they could have their babies. So the first question I would be asking is, at what point in your marriage did you discover that conception was a challenge?
Okay, so we discovered at the second year of marriage. We're 8 years in marriage now. Got married 2017. But initially we had the understanding, both of us, that we wanted to have 1 year, at least a year to ourselves, just to enjoy marital bliss and all. But it was at the second year of our marriage we knew there was an issue.
For a couple that had to wait for years before you had your baby, in a neutral situation, a couple waiting for a baby or having conception issues would think of running to the hospital. And when you run to the hospital, they tell you to take series of tests, which is the area of specialization of your husband. And they tell an obs and gynae doctor to interpret it, which is your own area. So now, knowing everything there is to know and having this challenge, how did it affect you personally? How did it affect the environment of the marriage and you personally?
Oh, yeah, it did affect us, especially in terms of sense of worth. It was an humbling experience for me, for us, being in the medical profession, because you are expected to know what to do. You are considered to be knowledgeable, and you should be able to, give yourself results. With the popular saying, physician, heal yourself.
Yeah.
And then it was like a blow to one's confidence, especially in that field where you are working. I found myself, so let me bring it home, let me be practical. I found myself trying to avoid people coming to me to ask what should they do concerning the issue of them conceiving, even when I know what to tell them to do. Because at times when you initially when I would try to answer their questions, you could see the expression on their face that, oh, if
People
it's that
knew the
easy,
situation,
why didn't you
hasn't
have the
it worked for
result? How hasn't it
you?
worked for you? And then and for some people it actually did work for you, but you then find yourself asking yourself, why is it not working for me?
Oh God, that
Like,
you recommended it to
yes,
them, it worked for them, and it did not work for
Yes.
you. Wow.
So that in itself. And how did I cope? I had to come to a point of realization, a point of self-realization that, yes, I am in the medical profession, I'm a doctor working in obs and gynae, but I'm human. I'm a human being first. Doctors fall sick. Doctors die. So if they could save themselves, they shouldn't fall sick. Then they shouldn't even die in the first place. So I had to come to that realization that just the fact that I'm a medical personnel doesn't mean that I'm immune from realities of life. So when I came to that point, it freed me. That burden of how I would attend to people, I got my freedom from that.
And what I picked from what she said is you coming to an objective conclusion about some certain realities of life. And that's the doctor's perspective. Let's hear her husband's perspective to it. So being in this field together,
Yes.
and everything you were taught or you seem to know is not working for you, how did it affect you?
Well, I'll go from how it affected us on the family side. I mean, if you look at it from the logical point of view, finding out what the problem is and attacking the problem, the logical thing for you to have is results. And I mean, when what is supposed to work isn't working, it doesn't make sense. It doesn't make sense, and it can lead to a lot of frustration. I would say it was very frustrating. It was frustrating, not for the lack of knowledge, but for the availability of knowledge, but no commensurate results.
Wow.
It was quite frustrating. At least knowing what to do
And what you do not
discovering
working.
and not giving the expected results. It was quite challenging.
How did you deal with it as the man of the house then?
Hey, man of the house, eh? in that scenario, there was no strong man anywhere because
I like the fact that you are being sincere.
I mean we're both going through the motions. We're both going through the issues ourselves. One of the biggest heartbreaks would be, I mean, as a man, you would become quite proficient in numbers and dates and periods and times. So there are once you're getting to the point of that month where you expect to get some confirmation and you see that particular look, you want to comfort her. I mean, my job expectedly is to comfort her and make her feel good. But man, I would do that, but inwardly I was shattered because it's a bit humbling where you wish you could actually give the solution. You wish you could actually provide a way forward, but you're powerless at that particular point to do something about it. So yes, you have to maintain the stance of the encouraging partner, and but you are dealing also with your own
thoughts and
disappointments and emotions. And I mean, in this society where men are not really expected to show frailty or show emotions and all that, I mean, it got to me a whole lot. I wouldn't lie. It got to me a whole lot.
I like the sincerity you are bringing to the table, because men out there might be made to feel that they are being weak for being emotional.
No.
If you feel like crying, cry, wipe your face, encourage yourself, and keep going. It doesn't make you less of a man. Another question I would ask you particularly, after going through treatments, because I know that as a doctor, you know about the treatments, some fertility tests, some ovulation boosting, this and that, and all those stuff. After going through those treatments, normally the hope is high that maybe this is it. Maybe this particular treatment will bring an end to the waiting. After the hope is high based on all those treatments and the period now comes, how do you feel and how do you handle it?
Okay, I would say that because I want to be very, very practical as possible. I would say that I went from different phases whenever we had a failed treatment or failed trial. For every failed fertility treatment or every cycle that didn't end in conception was painful. even though I know that, okay, not every cycle should result into pregnancy, even those who don't have any factors disturbing their conception don't get pregnant every time. It was a painful experience. It was a painful experience. But what I just realized was that initially you would start from the place of hope. It's like as the cycle progresses, after you are done with a cycle, you're like, okay, I'm hopeful it's this month. And then you get to the fertility window period and you're like, oh, you've given it all your best. And there's that the phase that's always very frustrating for anybody in the waiting period, is when you are counting days to confirm if it has happened. The anxiety,
the way your husband did his head, it shows that he's going down the memory lane.
Oh, the anxiousness, and then at times the mind will play some form of tricks on you. Especially now, me being a medical doctor. Oh, every nauseating feeling, could it be every cramping? Or is it the cramping of menstrual cycle, or is it a cramping from pregnancy? Only to now dip, just maybe a day or two missed period, and then you dip and you see a negative outcome. Just a single, oh God, it was. And then, like he said earlier on, men, they don't voice
their pains out often.
And I think women who are also in that waiting phase, what they always notice is he's not speaking, but you could see it in his eyes. That alone, it's going to add to that pain. I wish I could just give this man a good news. Just to see that reaction from him. So it was
from
always
the man's perspective, one of the cardinal things you said is that having to work towards conception makes you proficient in counting days, counting. So when treatment has happened, the hopes is high, and the test eventually shows that there was no conception. How do you feel? And how do you deal with it?
Well, during those periods, I discovered almost all the pharmacies in my area, because I was a designated procurer of pregnancy strips. So at a particular period of the month, I knew that, okay, it's time to go get these strips again. And then sometimes I have to make sure I show them my ring so they know I'm married. So they don't feel like,
what is
maybe
this
is this a random man who is always coming to buy pregnancy strips and all that. We're always going through that emotion, the period of hope to the period of waiting, and then you see that look. There's a particular look I would see, and I would know that
it's a no.
Till next month again. You get. And I can't count the number of times when she would be emotional and she would be crying and all that, and I have to maintain my own composure,
regardless of how you are feeling.
Regardless of how I'm feeling, because even just imagining how she would have felt at that particular moment was enough pain for me, and it was an emotional roller coaster for me as a man. But I had to sometimes put my own feelings second and make sure that she was comforted. You get so. Yeah, there's a whole lot more that I can't really even put in words right now, because those moments were highly tense moments, and
I appreciate the sincerity you are both bringing to the table, because it's helping somebody out there to know that they are not weird for feeling the way they are feeling. And it's also bringing hope that if they went through all this and there was joy at the end of all this, that they too can eventually weather their storm. I'm going to ask a 3-in-1 question now. And the question is, did you as a man go alongside with your wife for the medical tests? Then the second question is that why are men often reluctant to go for fertility tests? The third question is why are all conception efforts or fertility efforts often directed, whether it's spiritually or medically, largely directed at the woman rather than the man?
Thank you, ma'am. So, from my own understanding, because women are the bearers of the children, they are like the vehicle through which the children come. The spotlight is naturally on them, and sometimes we are, for a better lack of words, we are like in the background, like supporting striker and stuff like that. So the society, and also the society that we are in, the African society, is one that places a lot of focus on the woman and probably leaves the man as the innocent one. But knowing what we know, I mean, it will be foolish to think that it's a one-way thing. But at the beginning, more of the tests and more of the focus was on actually. And along the line, the expert he recommended that you also should go for a test, at least so we are able to balance and know what's happening on both sides. The ego that men walk around with is quite strong here in Africa. It's quite strong in Nigeria. And even if you go by tribe, you find out that different tribes have different ways of elevating men above faults, above issues and all that. So naturally, once there's an issue, it's the woman you're facing. The man is the last to get tested for most of these things. And even during my period of practice, we had more women coming for even regular tests, regular health checks. So I would say there's a disproportionate attention on women when it comes to health-related issues. Women are more motivated to want to find out what's happening health-wise. Men are a bit laid back in this society. I probably can even say globally. It's something that I believe is starting to shift because men are becoming more aware of their health right now. Sometimes you find out that it's a two-way thing. Both the man has issues to attend to, the woman also has issues to attend to. So they are like multifactorial approaches to the fertility thing. But you find out that society has put all the focus on the woman as the culprit in these issues. And most times it's the man. So, I mean, being the supportive husband, we were going to all our appointments together.
Wow.
There was I can barely count any appointment she had to go for alone. So
award-winning husband.
I mean, because the weird thing is that even in the medical practice, societal biases come to play.
Yeah. I was supposed to ask her.
So most times, my presence there is also to show support for her, so that before you start looking at my wife funny, you can see that, am I bullying you? What are you saying? So sometimes I would have to ask questions or even tell them that, okay, based on the results that I did last, these are the results. So what medicine am I also supposed to take? Before you start heaping all the stuff, because I know I'm going to go back home to deal with the effect of all the careless words that you have said. Wow. You understand? Because being a medical professional does not even excuse some people from careless talk and from showing their bias towards women. So, I mean, it was a support-based period for us.
So before you come from a professional angle, men, I hope we are listening. The support means a lot. It gives the woman this notion that I'm not alone in this. Somebody's watching out for me. Even if I have to cry, there's a shoulder to cry on. And it also presents the man as being fair. That, okay, I'm not seeing it as it's an issue to deal with. I'm seeing it as our issue to deal with. And please, medical practitioners, I have enough of them in the family. Please, let's be sensitive. We know it's our profession. We know we can't afford to be informal. We have to be formal. But even in being formal, please, let's be sensitive to people's feelings. Let's be sensitive to people's emotion. You know, the way many people view doctors is like the way they view God in their subconscious. And when doctors say this thing cannot work, even when there's an opportunity for it to work, if done in another way, you have already shut down the morale that they require to venture elsewhere. So please, when it comes to sensitive matters, please let's be diplomatic about the use of words. We can always say the same thing and be kinder in the way it is presented than just saying that, oh, it's a medical term. Yes, we know it's a medical term, but you are talking to human beings with emotions, with feelings. It was saying something very laudable. After all you have said, the man at home or the woman at home will be the one to receive the spiral effect or the ripple effect of all those careless words. The crying, the crankiness, the depression, whatever it is, somebody will have to deal with it. So please, don't compile the issue on ground. So from medical angle, please can you come in? Why are women more often looked at as the culprit when there are conception issues rather than the man?
Okay, so first of all, like he had said earlier on, the society we find ourselves in, despite the fact that, okay, being in the medical profession, you should be enlightened, you should be exposed, you should know that, okay, it's a male and female factor that comes to play when it comes to conception. But in recent times, we've realized that now the new trend is, and that's what I also do practice, before I have any conversation with a woman who is seeking help when it comes to conception, I want to see your husband first. Because now we realize that it's unfair to the woman. She has a lot of tests. Even the fertility profiling, it's looking biased already. But because actually the way it's because no, a woman has a lot of things like
more battery of tests to
more poking, more
through.
invasive procedures done on the woman. So before I put a woman through all of that, I want to know that the man is fine, first of all. And that doesn't excuse him from being supportive. But it's unfair putting her through all that only for the man to now say, I am fine, I'm not going to be tested, leave me. I have impregnated someone before. I have tested myself before. And I asked them, how are you sure that child was yours? Is it true?
That's good.
How are you sure that child was yours? So, first of all, recent times we make sure that the men first of all do. Theirs is majorly just one. Sperm analysis and MCS is when there's an issue on that, we then can maybe ask them for a further test. But a woman will have a hormonal profile with needles. We'll ask her to do scan, and then she will expose herself. HSG, very painful. So before, at least so that, okay, when we evaluate the man and we say, okay, he's fine or he's not perfect, we can give him medications to make him better, and then before we then focus so that we have a better outcome. But generally, I think medically we are beginning to get more response.
That's good. I hope the men keep it up. So, being a faith-based couple, spiritual and practicing your faith actively, I noticed that many faith-based people believe that because they are serving God, they love God, they are living right, they are supposed to have things easy in comparison to others, probably others that are sinning or whatever. I've heard people say, but I kept myself. I didn't mess around in the university. I didn't, when my friends were clubbing, I didn't go to club. And I married a virgin. How come I still have to look for children, look for pregnancies and things like that? So as a faith-based couple who took your spiritual work seriously, finding yourself in this kind of situation, how did it affect your spiritual work?
I'll need to be very realistic here.
Please be.
There were periods when my major prayer was that God should help me doubt my doubts. Because, I mean, you will have pronouncements made. You're actually visually ticking all the right boxes, doing what you're supposed to do, diligent in service, praying, confessing, and all that. But it still didn't happen. Sometimes things like that can make you re-examine what you hold as beliefs. I mean, if not for a foundation that is strong, what we went through, I'm sure many people have not gone through stuff like that, and they've given up on the entire faith, on faith. Faith was very important for us, even though we still made sure we did the right thing medically, but faith was very important for us. And it was a major test of faith. I wouldn't lie. It was a major test of faith. Sometimes you're unmotivated to even do what you're supposed to do because you're like, I mean, all the ones I've done in the past, there should be like a big reserve somewhere. There should be a big reserve somewhere. I mean, because I've said the same thing 1,001 times. But then sometimes you also remember that even the parents of John the Baptist, I want to believe they were very upright folks.
Yeah.
But they had to wait a long time.
They had to wait a long time.
You get. And I'm actually, in fact, even in reality, I know folks that I can say in quotes were more, I can say like, these ones are very holy. But they are going through the same thing. So I'm like, wow, if this person or if these folks can be going through stuff like this, then the fact that you're in faith does not really, it's not saying that you're not going to go through life's issues.
Hello, everyone. Welcome to this session of Ask the Love Doctor, where I pick one of the questions sent to me and I trash them. So today I'm going to be answering the question that said, how can I gauge my partner's sexual compatibility with mine before marriage? How can I gauge my partner's sexual compatibility with mine before marriage? And this is a vital question, because one of the key things that pull partners apart or pull couples apart is sex. Either sexual indiscretion on the part of a partner, or insufficient sex, or non-existent sex. So it is good to want to know whether you are on the same page sexually with a partner before you tie the knot with them. And the things I would want you to look into, or the things I would want you to ask the person in order to be able to judge sexual compatibility with them, is to ask them about their sexual past. And when I'm talking about asking them their sexual past, I'm not saying you should be asking about body counts. How many people have you slept with? Where did you sleep with them? No. You just want to know whether they are sexually exposed or sexually experienced or not. Because if they are not sexually experienced, many things in their head will be more fantasy inclined. But if they are sexually experienced, they have yardstick of comparison, and they have memories that subconsciously you might have to compete or contend with. So you want to know
what their sexual experience is. And in some people's case, it's not even sexual experience as them going out to actually sleep with someone. Sometimes it could be that they were sexually abused or sexually harassed. And all this can influence how responsive to sex they would be. If they happen to have been sexually abused, you want to find out whether they've undergone therapy, whether they've found closure, whether they've healed from that pain of the past. Because if they have not healed from the pain of the past, it might affect their sexual responses in the future. So, but if you find out that your partner has been sexually experienced, the person has engaged in relationships and engaged in sex before meeting with you, you want to ask them that, okay, was your sexual experience within the normal boundaries or within the, I would not want to use abnormal boundaries, but I would want to use the word, maybe the non-regular boundaries. Because some people practice BDSM and all the sorts. You want to know so that you'll be able to ask yourself, can I cope with this? Can I compete with the memory this person has? Apart from asking the question about their sexual experience, you also want to ask questions about their sexual fantasies. Some people might not have experience, but they have fantasies. You want to ask, oh, when you get married, what would you want sex to be like with your spouse? And when they start recounting what they want sex to be like, then you ask yourself, can I do this? Am I up for this? Then you can also relay your own. Oh, this is what my sexual fantasies are. This is what my sexual experience or sexual past has been. Then you juxtapose it. Oh, can we work together? Am I willing to make adjustments to fit what this person's fantasies are? And lastly, you want to ask, how teachable is this person and how teachable are you? There are times when their fantasies or their expectations are not things that will be harmful to you. There are times when they are not things that are out of the ordinary. But you want to ask yourself, are you willing to learn those things if there are things you are not familiar with? Are you willing to make the necessary adjustments to fulfill those fantasies? If yes, then the two of you are fine. If no, then there might be an issue in that area, which you might want to consider before going forward, or you might also want to think about as a basis for withdrawal. Lastly, communication is important. No matter what fantasies are in the present, no matter what their sexual experiences are, over time, people's taste might grow and people's taste might change. So you want to ensure that you are the type that can freely communicate your sexual desires with one another, and you are teachable enough to make the appropriate adjustments. If all those things are in place, then you can be sure that you would find yourselves compatible sexually and you will be able to find sexual fulfillment. I hope I answered your question. See you the next time. Thank you.